Everyone, my name is Dr. Zainab Nasser, and today I will be discussing a case of acute renal failure associated with diffuse infiltrative lymphocytosis syndrome. Before I go ahead and get started, I do want to go over 3 learning objectives. By the end of my presentation, I hope my audience will be able to recognize an atypical presentation of diffuse infiltrative lymphocytosis syndrome, to be able to identify a cause of acute renal failure in HIV-positive patients, and to be able to identify treatment options for patients with acute renal failure secondary to diffuse infiltrative lymphocytosis syndrome. Now I want to go on to a brief introduction. There are many causes of renal failure with varying degrees of severity. It's important to have a wide differential diagnosis for renal failure, keeping in mind rare causes to prevent the delay of diagnosis and treatment. Diffuse infiltrative lymphocytosis syndrome is a very rare cause of renal failure and is mostly seen in patients with HIV. It's a disorder characterized by circulating and infiltrating CD8 positive T cell lymphocytes, and it's been shown to affect the central nervous system, the liver, the lungs, the GI tract, and the kidneys. In this presentation, we present a rare case of diffuse infiltrative lymphocytosis syndrome causing acute renal failure in a patient with HIV. Now let's move on to the case. We have a 39-year-old female with a history of HIV adherent to heart for 3 years who presented with a 2-week history of lower extremity edema. On presentation, she had significant proteinuria with acute renal failure. Her baseline creatinine was around 1, and her creatinine had bumped up to 3.6, and her GFR had dropped to 21. Urine light chains were consistent with a glomerular proteinuria, and imaging showed diffuse lymphadenopathy. CD4 count was 727. She was diuresed with improvement in her edema, but her kidney function continued to worsen. She ended up having a renal biopsy, which showed lymphocytic infiltrate, with associated lymphocytic tubulitis composed of predominantly CD8 positive T cells, consistent with the diagnosis of diffuse infiltrative lymphocytosis syndrome. She was started on steroid therapy in addition to heart, and her kidney function eventually improved. We present an atypical case of diffuse infiltrative lymphocytosis syndrome causing acute renal failure in an HIV-positive patient. Now, let's move on to the discussion. Diffuse infiltrative lymphocytosis syndrome is a rare multisystemic syndrome that can manifest in untreated HIV-positive patients, but rarely affects those with normal CD4 counts. It's a CD8 positive T cell lymphocytosis associated with CD8 positive T cell infiltration of multiple organs. It's been described as a Sjogren-like disease associated with sicca, lymphadenopathy, bilateral parotid gland enlargement, and extraglandular organ involvement, including the central nervous system, the kidneys, the GI tract, and the lungs. There have been rare cases of acute interstitial nephritis. The renal manifestation has been described with tubulointerstitial disease, mild-grade proteinuria, and enlarged kidneys. Renal biopsy is often diagnostic. I do want to bring your attention to the histology that I have on the right. This is not from my patient specifically, but this is a histology that you would see in a patient with diffuse infiltrative lymphocytosis syndrome. In Figure 1, this is a renal biopsy specimen. You can see lymphocytes, plasmacytes, and fibrosis infiltrating the renal interstitium. There's also segmental and global glomerulosclerosis. And in Figure 2, this is an immunostain, and it's showing lymphoid cells that are expressing CD8 and CD138. Now, moving on to treatment, patients with diffuse infiltrative lymphocytosis syndrome that's affected the kidneys have been shown to have improvement in the renal failure with steroid therapy, as well as resuming their HIV medications. Now, to conclude this case, I just want everyone to keep in mind that while there are many causes of acute renal failure in HIV-positive patients, careful attention should be paid to history and other possible syndromes in such patients. There have been several cases reported of renal manifestations of diffuse infiltrative lymphocytosis syndrome. Therefore, clinical suspicion should remain high in patients with HIV, regardless of CD4 count. It is more common in those that have low CD4 counts, but it is still possible in patients with normal CD4 counts, as we saw in our patient. And finally, these patients are usually successfully treated with steroid therapy and HIV medications. Thank you so much for taking the time out of your day to listen to this presentation. I hope you all have a wonderful day. Thank you.